right. Well, welcome everyone, and hi to our Facebook family again. As it is another stroller social. So we have another stroller social here. And actually, the weather's pretty nice, so we could have gone outside for a nice little stroll. But as you know, we still are in a pandemic. We're still trying to be as safe as we possibly can. And so today we are meeting virtually. And we are just excited to be here. And I'm really excited for this nice weather that we've had the last couple of days. So hopefully it keeps up and we can keep these moving and going. This is really exciting that we have some nice weather. But tonight, for our stroller social, we are still on the pandemic subject. And even just, we want to talk a little bit more about the vaccines, right? We've heard so much about vaccines and how they are here in Columbus and how some people have been able to get vaccinated, others still have to wait. And what does that actually mean, right? And what does the vaccine mean for us? And are we going to, get back to normal of what we would think is normal. So tonight we actually have our guest. We have Rebecca with us from Columbus Public Health. We were very excited to have her. So I'm going to let Rebecca introduce herself, and I'm going to ask her to tell us something fun about her just so that we can get to know her a little bit better. But Rebecca, thank you so much for joining us tonight.
Thank you so much, Sarah, for inviting me to join in on this Celebrate One Stroller Social tonight. I work for Columbus Public Health, and I'm the Community Engagement Strategic Advisor there. And basically, that means that I'm a conduit to the community and from the community back to Columbus Public Health. And one fun fact, I'm a foodie. All my friends know I love to eat, I love to cook. I've been really missing having intimate friend dinners during this time, and I'm so looking forward to bringing those back. Or with the nice weather, restarting them up outside. But two of my favorite restaurants lately that I've been getting a lot of takeout from has been the Pit Barbecue. They opened up a new place in my neighborhood, and they have delicious barbecue food. And the other is the Yemeni restaurant over off of 161 area. They have delicious food as well. Their rice and lamb and hummus is delicious. So that's just a fun fact about me, and I relate to all fellow foodies out there in Columbus.
Yes, that's great. Thank you so much for sharing that with us, Rebecca. And I'm a total foodie. I love food as well too. So I'm excited just to even, I don't know, sit outside, like you said,
Mm.
and enjoy some food and be around some of our friends and family as well. So again, thank you for joining us. Tonight, we do have a few questions for you about COVID in general and the vaccine. So, I'm going to start with our first question. And it is, we all know that the vaccine is here in Columbus, and we just heard, all this stuff about there's a couple of different vaccines out there and different things like that. But one of the big things I think I would like to know is this vaccine free, or are they going to charge our insurance and then I'm going to receive a bill later? Is this vaccine free?
It is absolutely free to you, the individual, the resident. There, you might be asked to bring your insurance card because providers are trying to recoup some of their administrative costs, but that would be covered by your insurance. There would be no charge back to you. And if you do not have insurance, no problem. Still sign up and get your shot, right? But it is free to you.
Awesome. Well, thank you for that. I'm excited to know that it is free. Um, and also, it's nice to know that they just may be asking for the insurance card, but it's not going to cost us anything, too. So,
Mhm.
thank you for clarifying that. We've also heard that I might have to bring some form of documentation or some form of identification with me to get this vaccine. What if I don't have access to my ID at this time? Would I still be eligible to receive this vaccine? And what if I was undocumented? Would I still be able to receive this vaccine?
The answer is yes to both. However, some ID is expected. but there's a long list of acceptable IDs. And if you go to the Ohio Department of Health website, their equity website link has all the examples of things that can suffice as an ID. And if you are undocumented as well, you are also eligible to receive it. But since the phases have been phased, they've been rolling out based on specific criteria, the people giving you the shot do need to know you're the age that you say that you are. So you need some ID that shows that you are who you say you are. So a photo ID of any type is excellent. And it also should have your birth date on it, right? So those are the two most important things, and that's for medical reasons and for the phased rollout reason. It is not there. You should not be asked to document that you have a certain immigration or residency status, and you shouldn't have to document a place of living address. The purpose of asking for the IDs is to document that you are who you say you are and that you are the age that you say that you are based on the phased rollout.
Perfect. Well, thank you for that. You just talked about
Oh,
that phased rollout. Oh, yeah,
yeah.
go ahead.
Oh, just say one other thing as well, that the federally qualified health center sites and local health department health vaccine sites have been doing this for a long time. So they want to make this as safe and easy as a process as possible. So the other thing that I also want to share is that if you have an ID that is expired but has all that information on it, that is also acceptable.
Oh, wow. That's awesome to know. So thank you very much for sharing that with us. You did talk a little bit about a rollout phase.
Mhm.
And so I'm going to kind of ask a question that goes along with that rollout phase. And it is, how do I know when it's my turn to go and get that vaccine, right? Like I know right now we're doing certain ages and a couple other people may have an exception, but how would I know that? And then also, how would I sign up to get that vaccine? So once it is my turn, where do I
Mhm.
go to sign up?
Yeah, those are great questions. And most people are hearing about the phase rollout. If you're watching TV, if you're listening to the radio or reading the paper or social media posts, there's a lot of communication going out right now informing our residents about the current phased rollout. So what's most important to know right now is we're kind of moving from phase one into phase two. And phase one was when there were limited vaccines available. And that's where you might have heard how hard it was to get in, to get an appointment. And the first group was our emergency, our clinical health providers, as you might imagine, right? And then we moved on to the 80 and above, 75 and above. But just recently, we started with 50 and above, starting tomorrow, right? So it's starting to really pick up. And we're also entering into phase two, which is when vaccines are more available. And if you've been hearing, we've had another vaccine that was approved, more shipments are coming to the state. So we're about to see a big explosion of vaccine sites and availability of vaccines. So, but the most important thing is to listen to your trusted news media sources. So if you have access to the internet, checking the Ohio Department of Health pages or Columbus Public Health or Franklin County Public Health, those are all great resources for finding out what phase we're in and checking to see if there are appointments available. Now, if you do want to schedule an appointment, you can do it two ways. You can do it online, which is a faster, simpler method. But we also understand that not everybody has access to internet or the ability to do an online registration or prefers to do a phone call. So if you want to call in to register at Columbus Public Health, if you live in the city of Columbus or the city of Worthington, you call 614 645 1519, and that's 645 1519, and you can get registered for your appointment through that process too.
Wow, thank you for that. And we will be sure to add that phone number into the chat afterwards, after we are done. So we'll make sure that everybody has that number that they can go back to as well. So you
Great,
did
Sarah.
mention, yeah.
Remembered something else as well. The state just rolled out a statewide it's a link off the Ohio Department of Health website where you can put in some information about yourself, your age, or if you have a health condition, and it'll tell you, yes, you're eligible now, or no, you have to wait for a little bit further. And then it'll also tell you the closest vaccine providers to your address. So it's supposed to be a one-stop shop, and potentially down the road, you're supposed to be able to register as well. And that's a new thing that has just been rolled out. But the tried and true method is to go through your local vaccine providers, in my case, Columbus Public Health, and do it by online or calling in.
Awesome. Thank you. Um, so you mentioned a little bit ago about us getting another vaccine here.
Hmm.
So I think that means we may have three vaccines that are here, including the new one, the Johnson and Johnson one, which I feel like a lot of people are starting to hear a little bit more about. But I was very much hoping that you could share with us what might be the difference between these three vaccines, and why do we have three different vaccines? So if you don't mind maybe sharing a little bit of information about those vaccines with us.
Sure, sure. So the first two vaccines that were made available in the US and in the state are the Pfizer vaccine and the Moderna vaccine. Both of those vaccines are 2 doses to receive the maximum effectiveness. But there are some slight differences. They are also both mRNA vaccines, which simply it means it's a messenger vaccine. It doesn't inject in eggs or human products or anything like that into your body. It injects in a manufactured protein, which tells your body to develop immunity, right? And it also does not inject a live virus into you either, right? But the differences between the first two vaccines, again, the Pfizer and the Moderna, is that the timing is different between the two. For the Pfizer, it's about 21 days from when you get the first shot before you can get approved to get the second shot. And for the Moderna, it's 28 days. And for the oh, I'm so sorry. That is Mr. Coco making his presence known. I apologize. But the other piece to understand about the two of them is that you can receive the vaccine for several weeks beyond that 21 or 28-day notice. So don't be worried if you get scheduled a few weeks further out. It is totally fine, and it will not change the effectiveness of either vaccine. The other important piece is the Pfizer is the only vaccine approved in the US right now for 16 years of age and older. Moderna is approved for 18 years of age and older. Now, the Johnson and Johnson, which just got approved last week, is a game changer for us locally and nationally. It's a 1 dose vaccine. It also doesn't have to be stored at the severe cold level that the first two had to be stored at. So, can you imagine? It's a 1 dose. You don't have to take off work. You don't have to schedule around a second. It's a 1 dose and you're done for now. But the other piece to understand about it has been some discussion about effectiveness ratings. And the one thing that I really want everybody who's listening in to know is that any of these vaccines is 100% effective against death and severe hospitalization, the severe symptoms that some of the long haulers, some of the people who had severe reactions to the virus have. They are all three 100% effective. And really, we take vaccines to avoid that in our lives and our loved ones, right? So that is the most important thing that I wanted to share about all three vaccines. Each one is 100% effective against death and severe reactions which would cause an emergency hospitalization.
Wow, to that point that all three are 100% protective against that. That's awesome. That is amazing. I love that you were able to share that with us tonight. Now, I know some of us may have a few, just kind of reserved thoughts about possibly not getting the vaccine yet, or just kind of a little bit nervous. And some of those nerves can come from that we feel that this vaccine was created super fast, right?
Mhm.
As we've only been in this pandemic pretty much a whole year now, and now we already have a vaccine. As we know, sometimes vaccines can take a while to create. So, um, is there anything that you can share with us about the vaccine and how it was created?
Yeah, and I absolutely understand that concern, Sarah. I have heard from people who are in my circle saying, I'm going to wait a little bit. I don't really trust the process. It feels rushed to me. We're corners cut, etc. But the FDA process is very robust. And the process for each of these vaccines went through thousands of clinical trials, right? And including very diverse participants in the clinical trials as well. But the most important thing I want to share is that this virus is very similar in its footprint to the SARS and MERS viruses from years ago. So our scientists who worked to create these vaccines already had maybe some vaccine protocols for how other vaccines were created. They also had the footprint from the SARS and MERS pandemics from as long ago as 2003 to start working with that research, right? So even though there's so much attention on these vaccines being created allegedly suddenly in under a year, the reality is that the research has been, there was a lot of prior research that aided in this. And our FDA policies, our Food Drug Administration policies, do require very rigorous testing before approving for manufacturing. So that's what I would want everybody to hear today, that the footprint for this research started years ago, and our federal government process for making sure our vaccines are safe and appropriate is a thorough one.
Yes, thank you so much for sharing that. As you know, I think some people may have some of those concerns, and it's just nice
Mm.
to hear that and be able to clear some of that up. Now, speaking of these vaccines, and when we go to get them, I know that I've even seen on social media posts from some of my friends that are nurses, but even from others that have already received their vaccine, how they've had a few different types of reactions to the second shot
Mm.
from getting that vaccine. So, can you speak a little bit on what we might see as a reaction to getting the vaccine? And is that a good thing that we get some reaction out of it too?
Well, thank you for that question, Sarah. There's a whole range of reactions. So it really depends on the individual. Just because your neighbor or a family member or somebody you know from work had some reaction doesn't necessarily mean that you will as well. The reactions can range from a little pain and swelling in the injection site to maybe having a low grade fever, some body aches, maybe feeling like you've got a low grade flu. I will share my own personal story. When I had the Moderna vaccine, and when I had the first shot, really nothing other than a little bit, much like getting my flu vaccine, maybe a little bit of soreness in the area. What I regretted was I went back to the office and immediately got on my computer and was typing away, and I didn't move my arm. I didn't do the wide motions and exercise it. And by the end of that day, it felt pretty stiff. But by the time I got the second vaccine, I knew better. So I continued to use my arm and move it, etc. And I had very little stiffness and pain in the arm. What I did have was feelings of low grade flu after getting the second vaccine, which many of my friends and colleagues have shared. They had similar reactions to that. But that is definitely a good thing because it means your body is building its immunity. It's receiving the medicine into our body, the vaccine into our body, and our body is starting to react to it and get ready if it ever needs those responses down the road, right? But again, there is a spectrum of what is okay. And you know your body best, and your primary care physician knows your body best. So if you feel like it's going on too long or your reaction seems a little more than it should be, contact them and talk through it with them, right? There's always, we want everybody to have peace of mind. And so in the end, at the end of the day, it's important if you feel like things might be a little out of sorts for you to check in with your primary medical provider and talk through that. But for me, it lasted about 2.5 days. And on the third day, poof, it was like nothing had ever happened. But for those 2 days, I did feel a little puny, but I was also extremely grateful to have been able to receive the vaccine and to know that I'm building immunity not only for myself, but for my loved ones and the community that I interact with.
Yeah, thank you for sharing that and sharing some of those different types of reactions that we could all get and how everybody has, a different reaction, right? Everyone's experience is going to be a little bit different. So thank you for sharing that with us. Now, of course, at Celebrate One, we absolutely love our moms and our babies and our families, and we want to show some love for our pregnant moms. So, of
Mhm.
course, the question that's coming next is this vaccine safe for our moms that are pregnant and breastfeeding as well? And, is it safe for them? And have we done a few studies? Have they been able to do, the kind of studies with some pregnant moms to see how that they have reacted to it and different things like that? So, can you share some information about our pregnant moms?
I could share some information. I am not aware that pregnant women were included in the early clinical trials, which I know raised some concern. But what's most important is that you speak with your OBGYN and with your primary care provider to find out what's right for you. We also know that many pregnant women are essential staff. They're working in frontline work, right? So, what the current message is, you can choose to have the vaccine if you choose to, right? But if you are pregnant and you have any concerns, talk to your physicians, talk to your primary care providers to see what's right for you. That is the most important thing, and particularly if you are having a high risk pregnancy or if you had a previous pregnancy that was high risk. It's really important that you be in touch with medical providers to find out what is right for you in those cases. The other thing that I would ask any pregnant mom to really look into is if you have had any allergies in the past, if you have any allergies to any of the ingredients in any of these three vaccines as well. That is also another important conversation to be having with your primary care provider. Regarding lactation, our medical information director had shared with me that there really isn't any history of vaccines affecting lactation. And so we're not expecting that to be an issue. But again, we don't know for sure, right? But there's not been that history. So I think the most important thing is to check in with your primary care provider, your physician, and ask for their feedback and advice based on you, the individual, what works with you. But I just want to close this out by saying we also know, as I said earlier, that a lot of pregnant women are working in essential roles and frontline jobs, and we want to protect all of our residents. So I hope that you look into this carefully. You speak with your medical care provider and make a decision that makes sense for you. But in essence, any pregnant woman can choose to get the vaccine should they choose to.
Thank you for sharing that with us. As we want to protect our moms, our pregnant moms, as much as we possibly can. So we want to make
Yeah.
sure, they have all the right information moving forward. So I think that's great advice to continue to have conversations, with your OBGYN and your primary care doctor to make sure that we're making the right decision for you. So thank you, Rebecca, for sharing that. Another question I think I've heard from quite a few friends and even other moms, and even for myself, right? My kids are starting to go back to school and in that blended learning. And then eventually, right, they're going to have to go back full time. And I think the big question here is, are kids going to get a vaccine? Are we going to see a vaccine for our kids anytime soon? As we do know that the vaccines that are here are really for adults, that, one is for 16 and older and the other one for 18 and older. But, are we going to see a vaccine anytime soon for our kids?
I think we will. The question is when, and I don't know the answer to that. I have heard that there are trials starting now with younger residents. I've heard 12 and above, you know what I mean? So it's still not the elementary school group, right? But we all want to protect our vulnerable communities. And of course, children are in that group too, right? So I don't have an answer for you today, Sarah, about when they'll be available. I just know that that is in process. And I've heard and I've read that 12 and above is the next group that they're looking at right now. It'd be great if we have something by fall, but I don't know. So we just need to stay posted and continue to look at sites like the CDC website, sites that are very vetted, provide the most accurate, updated information. That we get our information from those sites, because that will be an important place to monitor when those start rolling out. But yes, eventually we will have those. The question is when. And I just wanted to take a step back. I realized I didn't talk as much about the Johnson and Johnson vaccine. So if we have a few minutes, I want to check in with you first. Can I go back and talk about that
Yeah,
for a few?
yeah,
Okay,
yeah,
great.
please.
Yeah, because I've had some questions. Both, is it as effective? Um, what does one dose, is one dose less effective than two dose, et cetera? What, how does it work, right? So all three of the vaccines work by boosting our immunity, our immune response. But the first two are mRNA. And the Johnson and Johnson is a viral vector vaccine, which is just a fancy term. And another is an adenovirus or something like that is another term for it. But it's taken like a common cold, but it's a manufactured version of it. So it's not going to make you super sick to get it or anything like that. But it's injected into you and it tells you to build the protein similar to the others, but the process is a little different. And I didn't explain that when we talked about the three of the first ones. So I just wanted to share that the first two are mRNA, and the newest one, Johnson and Johnson, is a viral vector um, vaccine. But really, it's a vaccine platform that's been used many previous times for other types of vaccines, and it teaches the body at the cellular level to build immunity. So
Yeah, thank you for, going back and being able to explain a little bit about the Johnson and Johnson and just a little bit of that difference. So I appreciate that. Um, we do have one more question for you. And so with this question, I think this is another one where, we're all kind of waiting for this answer. But, as we are getting vaccinated, we've been told that we should still wear a mask. So is that true? Do we need to continue to wear a mask after we, get our vaccine? And how long do you think we're going to have to continue to wear our mask until they say it's safe to not?
well, the CDC just released some updated guidance around mask wearing. I think now, because before it was you were supposed to wear it in your home too when you were around people, etc. So now with family members, with people who are in your pod, the pandemic language that has popped up is interesting, right? But there are chosen family members as well, or chosen pod members for you. So if everybody is vaccinated, etc., you can stop, wearing the mask. But when you're out in public, when you're still interacting with people who aren't in your immediate circles, it's important to continue to wear the mask, because you just don't know. There's still science to be done, there's still research to be done about whether somebody who's been vaccinated could inadvertently give it to somebody else. You might never experience anything, because that's partly why we're getting vaccinated, but you might be able to give it to somebody else, or you might get something from somebody else, right? So for the near foreseeable future, the recommendation is to continue to wear masks when you're out in crowds, in public, interacting with people who haven't been vaccinated, who are not part of your regular circle, right? But without knowing a date, I don't have a date for you, Sarah, but I think that most of us in public health are now saying we're seeing a light at the end of the tunnel. That day is coming. We don't know when it's going to be yet, because we still want everybody to follow the best possible guidance to keep not only you, but the people around you healthy. So there is still a recommendation to wear masks even after being vaccinated when you're interacting outside of your circles, right? But again, we're all eagerly wanting to know the date when that guidance will change for sure. But there's already been one significant change with this recent CDC guidance. I think everybody is so eager. And I don't know if for me the appropriate phrase is getting back to normal, you know? I think that some things will change forever. I know I'm far more conscious now about washing my hands, you know, all of the videos that taught appropriate hand washing. That's something that's changed for me. I do that many times a day now. So some things that are good basic health practices will hopefully be embedded in us and go forward from now. But I think everybody is eager to get to a place where we can hug each other again, we can eat together again, and gather, like you said, whether it's outside at a park table or anything like that. So we are all wanting to do our part right now to make sure we can get to that place.
Yes, thank you so much for sharing that with us. I think you are correct that, this is one of the things. I think we're all just waiting to see if we can get rid of those masks and see everyone's full face
Yeah,
again.
yeah.
So I think, eventually we will definitely get there. And right now we're just going to continue to protect ourselves until we can get there. So, Rebecca, I just want to thank you so much for joining us tonight. This was such great information. I'm glad we were able to talk about this and answer some questions for, our moms and our families and our community to make sure that everybody, can rest a little easy on some of those things that we may have thought what's going on, but being able to hear it from you has definitely helped and being able to get this information out there. So I just want to share, with our Facebook family that Celebrate One is still here, working and connecting any of our moms and our families and dads to any other resources that you may need in the community. So if you are pregnant or parenting a young child, please reach out to us and let us get you connected to any resources. And you can actually call or text us, and we will text you back or give you a call back, whichever one you do. But give us a call or text us at 614-570-3592. Okay, again, that number is 614-570-3592. You can call or text us. And I just wanted to let everybody know that we are still out there working. Our community health workers are definitely, checking in on all of our moms, all of our dads, and our families, and just making sure that everyone is doing okay. So I'm just happy and excited that we were able to do this, and we will definitely be seeing you guys next month. So on the 14th, April 14th at 6:30, we'll see you for our next Stroller Social. Thank you, everyone, for joining.